Welcome, everyone, and a huge warm welcome to our Urdu-speaking community joining us today for this Health Explainer. If you have ever stood in the pharmacy aisle just completely bewildered by the sheer number of allergy medications on the shelf, you are definitely not alone. It can be incredibly confusing. Okay, let's dive into this. Today, we are setting up a true head-to-head matchup between two absolute heavyweights of allergy relief, Loratadine and Desloratadine. We're going to break down the science and demystify these two medications so everything is crystal clear and super easy to grasp.
To keep things moving, here's our quick roadmap. First, we'll introduce the contenders. Second, we'll look at how they actually work inside your body. Third, we're comparing the benefits. Fourth, we'll run through side effects and warnings. And finally, we'll give you the final verdict.
All right, let's kick things off with Section 1, the allergy contenders. We all know that seasonal allergies can be just sheer misery, right? The constant sneezing, the irritated eyes, those sudden skin reactions, it can literally derail your entire day and make it impossible to focus. So which allergy medicine is actually better to get you back on track? It's honestly one of the most common questions patients ask their doctors. And here's the kicker. While both of these treat the exact same symptoms, they leave a lot of people scratching their heads because of their similar names. Loratadine and Desloratadine. They sound almost identical, but there is a fascinating scientific difference between them.
Before we pull them apart, we kind of need to know what they share. So the crucial point is that both of these drugs fall under a modern category called second-generation H1 antihistamines. Basically, when pollen attacks, your body releases a chemical called histamine. These medications, they jump in and directly block those histamine receptors. And because they're second-generation medication, they manage to relieve your symptoms while causing significantly less drowsiness than those older allergy pills from decades past. You probably know Loratadine by its common brand name, Claritin, and Desloratadine as Clarinex.
On the surface, their benefits are virtually identical. Whether you're dealing with spring pollen, year-round perennial allergies from dust mites, or random skin allergies, both medications hit the exact same targets. We're talking sneezing, a runny or itchy nose, watery eyes, and even chronic hives, which is medically known as urticaria. Plus, they both give you roughly 24 hours of solid relief.
Moving right along to Section 2, how do they work?
So if they treat the exact same symptoms, what is the actual difference? Well, it all comes down to the metabolic journey they take once you swallow them. Think of Loratadine as a prodrug. It's essentially a locked medicine. Step 1, you ingest the pill. Step 2 is where the magic happens. It travels to your liver. Your liver acts like a chemical key, unlocking and converting that Loratadine into its active form. Step 3, that newly unlocked active form, which, spoiler alert, is called Desloratadine, travels through your bloodstream to directly block those receptors and calm your immune system down.
Now, what's really interesting about this is the direct connection between the two. Desloratadine is quite literally just the pre-unlocked version of Loratadine. Mind-blowing, right? If you take Loratadine, your liver absolutely has to activate it before it does anything. But if you take Desloratadine, you're taking the already active metabolite. It entirely skips that liver conversion process and can get to work immediately.
Let's head into Section 3, comparing the benefits.
So how does that liver processing quirk translate into real-world relief for an allergy sufferer just trying to get through the day? Well, because Loratadine is basically the parent drug. It's been around for a long time, it's highly affordable, super easy to find over the counter, and remains an excellent choice for most people with mild to moderate allergies. However, because Desloratadine is already active, meaning it doesn't rely on how efficiently your specific liver works, it might kick in slightly faster for some folks. Plus, it can offer more consistent, long-lasting symptom control without as many peaks and valleys.
Then there's the big question of fatigue. We established earlier that both are second generation, meaning they are considered non-drowsy. But if we really split hairs here, Loratadine has a low risk of drowsiness, whereas Desloratadine has a very low risk. So if you're someone who is super sensitive to feeling groggy from allergy meds, Desloratadine definitely edges out the competition on this front. Another fascinating direct result of that liver processing difference is the dosage. A standard adult dose of Loratadine is 10 milligrams taken once a day, but Desloratadine, it's only 5 milligrams once a day. Why? Because it's already active. Your body doesn't lose any of the medication's potency during that liver conversion process, meaning you literally only need half the milligram amount to get the exact same 24-hour relief.
Okay, Section 4, side effects and warnings.
Now, like any good health explainer, we have to pivot to an objective look at the potential downsides, because no medicine is universally perfect. Looking at the mild side effects, you'll see they are remarkably similar. With Loratadine, a small number of people might get a headache, dry mouth, mild tiredness, dizziness, or a bit of nausea. With Desloratadine, it's largely the same. Headache, dry mouth, fatigue, though a sore throat is sometimes reported too. These are generally mild and pass quickly, but they're definitely important to be aware of. We also need to clearly state the emergency warnings. While these are very rare, you must seek immediate medical attention if you experience signs of a severe allergic reaction to the medication itself. We are talking about difficulty breathing, swelling of your face, lips, tongue, or throat, or a fast, irregular heartbeat. If any of these happen, it is a medical emergency that requires immediate intervention. There are also some specific precautions to keep in mind. Extra caution is absolutely needed if you have severe liver or kidney disease, or if you are pregnant or breastfeeding. Children should only ever be given age-appropriate doses. Crucially, do not mix these with alcohol or other meds that cause drowsiness. They can also interact with specific drugs like ketoconazole, erythromycin, or cimetidine, as well as other antihistamines, so always double-check your current prescriptions. Which brings us to Section 5, the final verdict. And this brilliantly illustrates our final takeaway. Let's summarize so you have a totally clear picture. Both of these are safe, effective, second-generation antihistamines that last about 24 hours. Loratadine requires the liver to activate it, uses a 10 milligram dose, and has a low drowsiness risk, making it a highly affordable, excellent choice for most people. Desloratadine is already the active form, uses just a 5 milligram dose, and has a very low drowsiness risk. It's totally perfect for those needing more consistent relief or for anyone who just doesn't respond well to standard Loratadine. Oh, one quick but vital note on storage. To make sure your medication actually works when you need it, always store these at room temperature. Protect the pills from moisture and direct sunlight. So storing them in a hot, steamy bathroom cabinet is actually a bad idea because it can degrade the active ingredients over time. And, naturally, keep them completely out of reach of children. Just a quick reminder, this explainer is strictly for educational purposes and is absolutely not a substitute for professional medical advice, diagnosis, or treatment. You must always consult a qualified healthcare professional before starting or changing any medication, and please never exceed the recommended dose. So we leave you with this final thought. Which allergy medicine is the perfect fit for your body? Now that you know the hidden liver science and the subtle differences between these two, you are totally empowered to take this knowledge directly to your doctor to find your ideal, personalized allergy solution. Thank you so much for joining us for this explainer. Keep asking great questions, and please like, share, and subscribe if you found this helpful.